Hello, everyone, both in the room and online. Welcome to the launch of our Future Health Index 2024. My name is Shez Partovi. I'm the Chief Innovation and Strategy Officer at Royal Philips, and it's absolutely my pleasure to be presenting that topic to you with our two key opinion leaders today. Now, we're here in this great energy of healthy youth, first time here in Europe, first time in Amsterdam, and also stone's throw from our headquarters of Philips here in Amsterdam, so that's fantastic. Now, the survey that we're going to present to you is called Better Care for More People, because we talk to leaders like yourselves all over the world to understand how they're meeting the challenges of healthcare today head-on with technology. But before we dive into that survey, I want to tell you about our guests here today with us. We have two distinguished guests, Dr. Chiara Bucciarelli-Ducci, as well as Marlies Schijven, Dr. Marlies Schijven. Maybe I'll just share a bit about each of our guests, and then we'll go into the survey itself. Now, I've gotten permission to use your first name, so thank you very much. Chiara is the CEO of the Society of Cardiovascular MRI, an international nonprofit bringing together medical and non-medical professionals in cardiac magnetic resonance imaging, alongside her cardiology clinic and academic activities at Royal Brampton and Harefield NHS Hospital in the UK. She's, of course, laser-focused on digital health, specifically cardiac digital technology, looking at challenges facing health systems and rethinking what can be done to improve care for all. And Marlies, Professor of Surgery and Chair of Digital at the Amsterdam University Medical Center right here in town, neighbors. Terrific to have you. We'll have a chance to hear about her research focus on how technology and digital innovation can be optimally deployed in patient care and in training of healthcare professionals, which is an important topic of discussion today. So welcome, both of you. Thank you for being here. Now, let's look at the survey, some high-level data first, and then we're going to go ahead and go back and forth looking at data and having a discussion a few times. Just to set the scene on the Future Health Index and what it is, it's the 9th year. It's the largest global survey of its kind. We surveyed 3,000 healthcare professionals from 14 different countries. And this year, the focus was to understand how they're applying technology to bridging the staffing gap, which they tell us is a problem, bridging the insights gap, because we have a lot of data, but really not a lot of insights, but also bridging the sustainability gap, which is not just about environmental sustainability, but rather also about financial sustainability. So those are the data signals in this report. These are incredibly timely, and I encourage all of you to dive deep. We'll dive into some of it today, but you can imagine this is incredibly useful information. So let's look at one high-level data set, and then we'll go back and forth together and look at these together. So the first thing, some data on bridging the staffing gap. So when we spoke to these 3,000 healthcare leaders, they tell us that there is a real delay in care delivery happening because of staffing. 77% express these delays because of staffing shortage. And not only is there a delay in sort of care delivery, but the staff itself are experiencing 66% of deteriorating well-being and mental health. Now, if you know, there was prior reports in prior years of 40, 50%. This year, the signals are even higher, that there's even greater sense of being overwhelmed, overloaded, and overworked. And of course, 81% of them express that there is a great financial burden, which is directly impacting patient care. So, delay of care, demoralized staff, and direct impact on patient care. Maybe, Marlies, we'll start with you. How are you experiencing this in your work, in your environment? What does data speak to you? How do you see it?
Well, thank you for the question, and thank you, first of all, for being here and being able to join this great panel. How do I experience it? I experience it every day. Almost daily, we are informed we have to close down one of the operating theaters due to shortage of staff. Now, imagine you're being that person lying in the bed, ready to go to the OR, and you hear you can't. And that's my daily practice. And then we have to go to the patient to explain, not that this operation went successful or eventful, most of the time successful, but to explain you cannot be operated upon. And so shortage of staff is one of our main concerns, how to onboard staff and how to retain staff. And well, my research, which I also do for European Union, a very big project, Keep Caring, is about retaining and also reinforcing healthcare staff. Yeah.
Thank you. Chiara, how do you experience it?
Yeah, I totally agree. I experience exactly the same, and in fact, want to congratulate Philips, for having this data, because it's very nice to have actually evidence-based on what is our daily perception. And I think the three aspects you mentioned, they're actually interrelated. There is a staff shortages of those working, then they're demoralized because they're overworked,
right,
and because of the pressures, and then also they're demoralized to see deficiencies, for the very healthcare system they're actually really proud to work for. So the challenge is, now that we realize that is the issue, how do we overcome and how do we use AI, creatively to actually be able to tackle these issues? And I think that's where, I'm personally quite interested as a healthcare professional, but also healthcare executive, with my two hats. I really wanted to try to jump in and make a difference in this world and trying to really improve the status quo of healthcare. But certainly this is the case and is in fact getting worse, with time. So there is an urgent need to actually tackle the issue, now that we've been photographing it. And know that's real.
Yeah, that's a great term. We've been photographing it, now we need to act on it. The two complementary, you talked about actually potential surgeries being delayed, which actually, people may not understand. That's a real, if you're a patient, you've been in prep, pre-op, and nothing by mouth the night before, end up in the hospital, and then in the morning, the surgery is delayed. There's a ripple effect on patients and families.
It is.
It's not just the surgeries delayed, there's a whole cascade.
But not only on the patients, also on the healthcare staff. It's terrible to not dress in your gown to go to the OR, but put on your white coat and go to the bed to tell you cannot be operated upon today.
Yeah.
And
the questions that come, why, what?
Yeah, and quite honestly, when I have outpatient clinic, one of the things I tell them, you're going to be scheduled, but it can be so that you're fully prepped and you're not going to be operated upon. It's already part of our disclosure to make it a little bit easier to convey the message when we have to.
Think about it. We are such staffing shortage that you're prepping a patient for potential moments before surgery cancellation.
Exactly.
That's a sad state of being at.
It is, yes.
And Chiara, you made a comment that is really key, which is clinicians want to be proud of where they work, and the mojo of healthcare, that joy of healthcare, is being squashed by the data set that we see, this sense. How do you bring that? Is that the joy feeling that are being lost?
A little bit. I think, it seems like healthcare professionals, have lost a little control, of what's happening in the daily job. And there's really this overarching uncertainty, that you were describing, that we experience this every day. And it's not just for surgery or, general surgery, oncology surgeries, for cardiac surgery. Bypasses have been delayed, people are continuing to have symptoms, and, imaging is delayed, everything is delayed. And so there is a knock-on effect. And I think there is, healthcare professionals, including myself and my staff, we need to find a kind of renewed, I think, wave of enthusiasm to actually go and try to change the way we deliver healthcare, for the better. I think it's enough that we've been seeing, it's like declining. And so I think the purpose of the profession is still there. And I think we see this in the younger people. There's still, thankfully, a lot of young people that go in healthcare, whether it's doctors or healthcare professionals. But I think we need a renewed wave of enthusiasm to actually be empowered. I think that's a key word, a little bit more, to actually be at the center stage of delivering healthcare. And
so let's see if we can put the clinicians back into the center of healthcare and empower them. Let's look at some other data to see, is there a way in which we can bring technology, and in particular AI, and you referenced it, Chiara, to help. Now, when we asked healthcare leaders across the world, it was interesting. So first they said, look, many of them, 99%, all of them, have implemented some sort of clinical decision support, which in the olden days was maybe alerts, and now it's becoming more sophisticated AI-based alerting. So there is a level of permeation of technology and AI to support care decision-making already. And then when you ask them, do you plan to invest in generative AI? 85% of the organizations said, in the next 3 years, we see this as a way of bringing a solution to bear for the staffing shortage. And yet in that same breath, 87% said, yes, and we have some concerns that there might be introduction of bias in the technology towards the application. So we need to make sure that we don't do that. And so as we look at this data, now, and in fact, when you look at that data on 87%, you even have some of the organizations in the US that are actually saying, don't trust AI. The California Nurses Union had some demonstrations recently saying that they don't trust AI, trust nurses. So there's a lot going on in a hope that AI will help, and this, but don't fail me on the other side. So maybe we'll start, Marlies, with you in terms of your experience of how this can help in this space that you work.
Well, I think it's important to realize who do you ask? And I don't know if the cohort that has been asked is, it might be so that they are overly enthusiastic in their expectations. And that's also what you see in the Gartner's hype cycles. The peak of inflation is high. I don't really think that 99% is using AI. I think they're using automated tools, which is probably something else than AI. I do think people have high hopes for AI. And in my perception, it's never technology that fails us, it's how we decide we deal with technology. What are the boundaries and conditions? What are the rules? What are the ethics regulations? How trustworthy is AI? Can we understand what the bias is? And those research questions are high in the sky and very much on the agenda of the healthcare system to date. And I think we need to dive into that deeply to really be able to grasp the power of AI for the better.
And is that occurring in your organization? Those things that you say we should be doing? Is that occurring?
Yeah, we are in. We have defined spaces, test environments in which we try out AI algorithms, and more often than not, we find they are helpful, but they also carry some risk or misunderstandings, or they need to be properly explained. And that's what we need to do first before we have to come back on a path we were just so eager to embark on. And that's what we're doing.
That's a terrific point. And just before I come to you, Chiara, that's equal to Philip's point of view, which is AI is a tool that is in the tool belt of the clinician, that it should be fair and transparent, but really supports the clinician in their decision-making process.
As a co-pilot.
And as co-traveler in the care paradigm that you have a blood test you do, an MR you do, and you have with you an AI tool set that helps you in your decision-making. I'm curious how you experience what's your perception of this data in the work that you do?
Yeah, so this data resonated to me very much, but I think I realized actually most of the people replied to the survey are healthcare executives, and so they're kind of the C-level suite. And I feel that we need to start to bring in a conversation, actually the healthcare professionals themselves, because it's all good that the use of AI is decided at the C-level suite, but actually the implementation, that's not where it happens. And so we really need to bring the implementers, which are the nurses, technicians, the doctors themselves, the surgeons, to the table so that they actually start embracing AI. Because if AI is imposed upon them, that's where we face resistance to change, which is a normal human behavioral issue that we find, I'm sure you face in innovation all the time, but unless you bring the key players at the table and you make them part of the process, we will always face resistance to change. And so I'm not surprised to see the result of the survey that nurses, the nurses strike at in California and stuff because they don't feel part of the process and therefore they resist it. And I think that's where perhaps we need to do a better job in empowering those healthcare providers.
That's true. I can't resist. You've done such an easy. I love your statement that the nurses and the clinicians, the physicians, should be included in the entire process of innovation. So what I can't resist is to say that that's literally described to a T how Philips operates. That our co-creation with our clinical partners is exactly that. You start with the clinician, the physician, the nurse, the patient, and work backwards to see what it is that you need to. So that's a really terrific point, because it's not one where you can come from the outside and implement and sort of just put in and expect usage, but you have to really find the problem space with the nurses and the physicians and then to innovate together. Is that occurring in your environment?
Well, this is how I'm trying to introduce AI in my department.
Okay.
By speaking with my staff and taking a step back and say, what problems are you facing? And so they voice the problems, and then I offer them the solution that some of the AI products have. And that's why I see that the initial resistance when I say, oh, we should do this research with this AI, people say, I'm not sure. Then I pause for a few months, and then I came back with a different narrative, and I see the uptake was massively different.
I'm curious, in either of your organizations, do you see AI as one that is improving, sort of taking out the repetitive automation, or you think of diagnostics? In other words, when we did the survey, 92% said, look, I think this can automate some administrative work for me. 92% said this can save time for me. And so there was an angle of that care means time.
Yeah.
And so I'm curious, in your organizations, is the lens one of, look, I can take away menial tasks, or is that one of, I can help make diagnoses? Because they're complementary, but I'm curious, maybe, Marlies, I'll start with you, and then Chiara here as well. Which angle, or maybe both, but I'm curious, is there a particular angle you come in at first? Care means time, or sort of help diagnosis?
Yes, I think what's important for people is to be able to do what they were trained for. And of course that will change also when we incorporate AI or new technology. But basically people want to provide care and want to feel empowered to do so well. And I think what we have seen the last several of years, technology didn't make it better. That only pushed more on the time schedule of our nurses indeed, and also of doctors. You have to fill in, well, before I can talk to a patient, I have to complete, I don't know, whatever. I think the best thing I trained myself to do as a surgeon is type blindly, because that saves me time. So I think we're on the lookout of where are problems, and that's very important, where are problems we can define, where technology may elevate us from a little bit of the administrative burden. If we can do that, I think also the trust will grow in this type of technology, and we can use it for higher stakes or standards maybe.
Terrific. Yeah. Work back from the problem. Chiara, what about your organization?
So I think in every job, including in healthcare and within healthcare, whether it's nurses, technologists, or physicians, there is always an element of repetitive task. And that's the most boring part of the job, right? So if AI can take care of that, I think everybody will be very pleased. And I think where we should use AI is really to augment the performance, of the professionals, whether again it's physicians or technologists. And so if that's what AI will do, I think at the receiving end, the healthcare profession, they can only like that, please that, because they really focus on their skills and skill sets, and AI just augments them, and they can more focus on that. And increasing, workflow, as I said, healthcare professionals at every level take very pride to work for the system. And if patients are very pleased, if the system is very productive, they only take actually a lot of pride on that. And so I see the potential for AI in both aspects, increasing the workflow by augmenting the skills and the professionality.
That's terrific. This actually came out in the survey as well. And really what I'm hearing from both of you is care means less repetitive tasks.
Yeah.
And when you look at the data, there was 38% of the respondents said that they believe that AI, through these tool sets you're talking about, can help them work at the top of their certification, which really means less repetitive. So this is an important point of the hope of, if you will, the survey respondents, that AI will help them save time and work at the highest level of certification, which really comes back to a point of the joy of medicine. So, look, we could talk about AI the whole day, and there are two more slides, and I want to make sure we cover these two topics as well. Virtual care. So obviously, when you talk about staffing shortages, we asked about virtual care because in some ways you can see how being able to have individuals from a one site deliver care to a remote site can help with staffing shortage. And not surprisingly, 89% already saw positive impacts of virtual care in their organization in managing the staffing shortage. And about 54% actually said that this flexibility is a way in which they can help even recruit and retain professionals, because you can imagine that some maybe younger generation physicians and nurses might prefer flexibility of time working remotely in some areas. And also there's a generation that's nearing retirement, so they don't want to necessarily work physically in the same space, but they still have amazing talent to give that they might be willing to work remotely. So from that perspective, maybe we'll turn and talk about remote care. And I'll start, Marlies, with yourself. Now, you also have experience in wearables. And so maybe a combination of your thinking on virtual care and with or without wearables in there as to how does that align with what you're seeing?
Yeah, I think if we can harness the power of Internet of Things, combining with virtual care, that would be awesome. You know, virtual care we do video consultation, but that does not necessarily alleviate our burden, because I still have to be on the other end of the monitor. It's just that the patient is not in my room. But for the patient, there are lots of benefits, and for the society, because the patient doesn't have to travel, can be at the home. If there's sad news, it's better to receive it on your own couch than have to travel back and forth to the hospital. So there are lots of things where virtual care fits, even if bad news needs to be conveyed, which we were wary of, but it turns out from research we don't have to be. I think if we can combine providing care at a distance using AI technology to flag cases that we need to recall or need to reach out to in the home environment, perhaps even by having nurses who, as you say, work partly in the hospital and partly from home providing virtual care, virtual nurse profile, that's the way forward. And I think many nurses would love to be able to give high specialist care in the hospital for 3 days and be home 2 days, being able to do their wash, to walk the dog, and also take care of patients behind their own computer. It's just that we not have figured out yet how to do that well and how to incorporate that solidly as proper colleagues in our hospital.
Interesting. In fact, that opportunity is also reflected in the survey, where I think it was a third of the respondents said that they believe exactly what you said. Using IoT, remote monitoring at home, is a way in which they can bridge this shortage of staffing by delivering remote care.
But the thing is, we need to be able to trust it. I mean, if you're wearing a sensor and you're unsure if you wear it well, or the alarm doesn't go off, or nobody looks at it in the hospital, you have a patient at home at risk. And that is what we don't want. And of course, if you're blind, you don't know. But if the data is coming in, you're not blind. And that's a tricky area.
Very important. The point is that remote care is a full service. It's not just giving someone you may or may not know, Philips has a whole business called biotelemetry, and all we do is remote monitoring of patients at home, which is a full service of technology and process and people. Exactly. You're absolutely right. It's not just throwing technology at it. In cardiology, this is an area where there is the remote monitoring is felt to be the holy grail. In fact, I just alluded to it with Biotel. Yeah. And of course, this is an area that you have passion for. What's been your experience there?
Yeah, it is. I mean, there is a wealth of devices in cardiology, from wearables to remote monitoring, telemonitoring, tele-reporting in radiology as well. So, sometimes actually clinicians are a bit overwhelmed by the solutions. And I think what we're lacking is maybe more kind of trials and randomized data that those wearables and those technology really makes a difference in terms of cost effectiveness for the healthcare system, in terms of clinical efficiency, and in terms of tackling the problem that you are aiming to tackle. So I think that's where we, as a community and leaders, we need to do more work. There is a component of education, I think, for clinicians or healthcare professionals on how to best use those wearables, understanding what it works, doesn't work. pitfalls potentially, and also education of the patients. I think we don't talk enough, perhaps, about this. Patients also feel a bit overwhelmed by wearing those devices. That's a new way to deliver healthcare, and patients that can be also elderly, maybe not so versed at this technology. So I think we need to be considerate of that and spend time to train them. The other component, I would say, that those wearables, yes, it tackles the issue of healthcare staff shortages, but I think a similar important narrative to me is really the empowerment of patients for their own health. Because if we focus on the fact that wearables are to tackle a problem, it somewhat gives a negative connotation because there is a negative aspect of the healthcare stuff. But if we actually sell them as we empower patients for their own health professionals, somewhat has a more positive spin and inevitably actually tackles the healthcare shortages as well. In fact, I'll tell you even more, it tackles also the environmental sustainability issue, right? Because patients travel less to the hospitals, less taxis and cars and all the rest. So they're all kind of interrelated, and the more we interrelate them, I think the more effective we will be in actually ensuring patients and healthcare professionals embrace this new way of delivering care.
I love that reframing. Cost is a factor that it maybe helps, but framing it as a benefit to the patients, brilliant. And in fact, since you touched on cost and sustainability, I can't help but to maybe go to the next slide. You perfect tee up there as our final slide and point of discussion here. When you look at that first data point that says that health systems and leaders say that, look, we are delaying investments because of the cost pressures. 92% had said there are cost pressures. 59% say we're delaying. Now, it may not be a surprise, but it's also important to realize what that really means, because when you look at the survey for a whole lot of sections, it says we have hope that technology will bridge the staffing shortage. We have hope that AI will help. We have hope that AI will help bring insights and do all this meeting. And then when it comes down to it, but healthcare is really not financially sustainable, and all these things that we think we can do with technology, we're delaying and not doing. So there is a paradox here of the hope of technology solving the problem, but the reality of financially not being able to deploy it because of cost pressures. And then maybe I'll talk a bit on the sustainability, and we'll turn and health systems in terms of sustainability and health leaders. Great passion for really reducing the carbon footprint, and 86% say that this is really a key point. So what really they're saying is care means sustainability. So you touched on cost pressures. Maybe Marlies, we'll start with yourself in terms of how does this data align with what you're experiencing here in the Netherlands?
I think we have great awareness of the problem of health and climate in the hospital. There are several green teams, we call them, who are sometimes have very little or minor initiatives, not having disposable cups no more, changing materials in the OR, reusing when we can reuse. But we are healthcare is a big industry in terms of CO2 production. And I think awareness is important. All those little steps and things settle into people's mind. If we travel to conferences, we are very much encouraged to take trains, for instance. Having patients using video consultation makes them not travel and save CO2, but it's all small. But I think as long as we realize all those small things add up, and it also changes the mindset, and that's most important, I think we're moving forward. And we have to. I mean, we only have one planet.
Well, your experience aligns with what the survey says, which is everyone thinks it's important. People also, the respondents said the government should step in, but when you actually looked at what they're doing, it was difficult. They were saying, look, I can only do so many things, I need to prioritize, and I don't even have funds to buy technology, let alone. So there was this, again, a dichotomy between really important, but the reality of where they need to be. So you're not alone in that experience.
That's true, and I think we need to be careful using technology also in that respect. I mean, data also, big data servers are tankers of data storage and CO2. So we need to realize what do we collect in terms of data and what do we do with it, and when do we need to let go of data also to free up space. And that's not so much on the agenda yet, but I think it's important.
Chiara, your thoughts?
Yeah, well, in imaging, I think sustainability is also very important. There is all this recycling aspects of the plastic material we use, but also, machines, they're more, they have less carbon footprint. And I think Philips has been a really pioneer in this field. Again, I go back with the perspective of the healthcare providers. I think they take a lot of pride to embrace and champion this environmental sustainability. And I think most so healthcare professionals, and perhaps all of us after COVID, wants to be associated with ethical values, in our workplace. And that's, again, augment, the sense of pride that we have in healthcare. So in my department, in my staff, and within the association of CMR that I lead, certainly we've been embracing this environmental sustainability, and very successfully so. And my members are even more proud to be members of my association, because we've been quite pioneering, actually, in embracing this. So more to come, and I think...
Terrific. Well, we're going to wrap up, and before, look, when I think of, I have a question for each of you, but look, we've gone through that. When we go through the survey, we get signals that says, for staffing shortage, care means productivity. For when you think of AI, care means automation, care means less repetitive things. Care means financial sustainability. Care means environmental sustainability. We are seeing signals that people say, this is what care means. Care means pride in the work we do. So it's terrific to see those signals come out, and thank you for sharing your experiences of how you live them, because we got signals from the leaders, but you're actually living them every day. So thank you for that. Maybe as a final thought for each of you, which is, if you could deliver a thought into the minds of the healthcare leaders all at once across the world, what thought would you insert? And maybe, Chiara, we'll start with you, since I give Marlies a break, since I go to her first. Well, what do you want every healthcare leader to think about and to realize and think? What's your...
Yeah, I think they need to exercise the leadership bottom up, and empowering healthcare professions and patients, to deliver a new healthcare. So if they empower the base, that's going to happen, and in fact, in an accelerated fashion. If it's imposed upon them, so with a top-down leadership, I think we're going to face resistance to change.
Bottoms up, organic, work backwards, work with clinicians, nurses, physicians, keep patients in mind. Wonderful. Marlies?
I would say, don't be shy.
Don't be shy.
Step forward, speak your mind, and be creative.
Love it. Co-create, bias for action. Let's try some things. Ladies and gentlemen, thank you for joining the launch of the Future Health Index 2024, and thank you particularly to our guests and sharing your thoughts. Thank you so much. We'll do some questions locally. Thanks to the rest of you. And there's the link if you want to add more thoughts. Thank you so much. We'll go to questions here and we'll go offline. Thank you. Have a great rest of your day.